Okay, my name is Whitney Shire. I'm a nurse practitioner student. Just washing my hands here. What's your name?
I'm Audrey.
Audrey, it's nice to meet you.
You too.
What brings you in today?
I'm having some head pain.
Okay, like a headache or what kind of pain?
Yeah, it's like a headache.
Okay, and when did you notice it come on?
A couple weeks ago.
And the location of it?
It's like right in this area, like the frontal.
Temporal region,
Yes.
right here?
Yes.
Okay, and the duration, like how long does it last when it comes on? Last the whole day, minutes, hours?
No, it's usually maybe about an hour or so.
Okay, and how about the character of it? Sharp, dull, aching, worst headache of your life?
Not the worst headache
Describe
of
it
my
for me.
life. It's mostly aching and dull.
Okay, and how about aggravating factors like being tired, working?
Fatigue, absolutely. And if I haven't had coffee, it usually comes on.
Oh, okay. Do you drink a lot of caffeine?
I do.
Okay. How about alleviating factors?
Well, ibuprofen will help. Caffeine will help.
Okay.
And usually at night I can just go to sleep. And that'll
Okay.
help.
Okay. So rest, your fix of caffeine and ibuprofen. How often and how much do you take that ibuprofen?
I only take about 600 or 800 milligrams, and it's maybe twice a week.
Okay. And do you notice that it radiates anywhere?
The pain does not radiate
Any
anywhere.
other part of your head or body? Okay. And the timing of it, does it come mornings, evenings? We kind of touched on that, but could you
Evenings
expand?
definitely are more often, but sometimes it's like late morning if I again haven't had that coffee.
Okay. And the severity on that pain scale of 0 to 10?
Usually about a 3 out of 10.
Okay. You said it was not the worst headache of your life,
No.
more dull and bothersome. Yes. Okay. Any related or other symptoms you've noticed, like fever, chills,
No.
nausea, vomiting?
No.
You mentioned tired and stressed. How about neck tenderness or like
No.
rigidity, pain in your neck?
No.
How about sensitivity to light or sound?
No.
Any ringing in your ears?
Mm-mm.
Okay. Well, those would all be symptoms related to other things that we may be dealing with here, but I'm glad those are all negative. Just a couple of general questions. When was your last menstrual period?
I think it was on the 2nd, so about 2 weeks ago.
2 weeks ago, okay. And past surgeries?
Just a tonsillectomy.
Tonsils.
10 years ago.
Okay. So about teenage years?
Yeah.
Okay. And family history? Any significant family history we should know about?
Nothing that significant. Grandpa had cancer and Dad has high cholesterol.
Okay. How about wellness history? Like when was your last eye exam and
A couple months ago.
physical or well woman exam?
It was like 8 months ago.
Okay. You denied any family history of like colon cancer, breast cancer. So have you ever had a mammogram or colonoscopy?
No.
Okay. I don't believe those are necessary at this time due to that history. And Audrey, just some general questions we ask everyone who walks through these doors. The questions are a little sensitive in nature, but just answer them openly and honestly, okay? Do you feel safe at home?
Yeah.
Okay, and safe in your relationships with your partner?
Mm-hmm.
And any thoughts of suicide, harming yourself?
Nope.
Harming others?
Nope.
Okay. Anything you want to talk about in that realm today?
No, I'm pretty good.
Okay. And what kind of medications do you take?
I'm on a birth control pill and like the ibuprofen, like I told you.
Mm-hmm.
And then I take a vitamin.
Vitamin. Okay, you said 600 milligrams as needed, not a whole lot.
600 to 800, yeah, just depends on.
Follow the bottle.
Yeah.
Okay. Any herbals or additional supplements? Just
No.
the vitamin.
Mm-hmm.
Any allergies? Seasonal medicine, food allergies?
No.
Okay. Tobacco use?
No.
Chewing or smoking? Drinking. How often do you drink? How many drinks per sitting?
I usually just have 1 or 2 per sitting. It doesn't happen very often anymore, but maybe once a week when my husband and I are both home.
Okay. How about illicit drug use?
Nope.
Current or past history?
Mm-mm.
Okay. Work, you mentioned. You sound like you're in the medical
I'm a
field.
nurse.
You're a nurse.
Mm-hmm.
Okay. And anything else going on related to work or stress?
I'm in grad school and
Okay.
I have a new baby. So.
Oh, goodness. All right, lots going on
Yeah.
for fatigue and stress. a nurse, grad school, and a new baby. Marital status?
Married.
Married.
Mhm.
One partner?
Mhm.
Okay. And could you expand on your diet and exercise? You mentioned caffeine,
I do a lot of caffeine. I drink a lot of caffeine.
water intake, diet, exercise.
Do try to drink a lot of water along with that caffeine because I know it helps flush it all out. I try to eat healthy as best I can.
Okay.
And I try to walk about 30 minutes a day, but
Okay.
sometimes I don't quite get
Yeah,
there.
you're kind of busy lately. Okay. Any pets in the home?
No.
Okay. Any recent travels or being around someone who has traveled recently?
No.
Okay. A couple more questions and then we'll get on with the exam. Any recent weight gain or weight loss?
No.
Fever, chills?
Mhm.
You said no, I think. Recent weakness?
Mhm.
Fatigue? You said you've been
Yes.
more tired lately. Okay. How about any trouble with balance or coordination?
Mhm.
Any recent or in the recent past infection? Anyone around you have
No.
any type of infection? Okay. Headaches, obviously.
Mhm.
Yes, that brings you in
Yes.
today. How about any recent loss of consciousness?
Nope.
Dizziness?
No.
Recent trauma or injury to the head?
Mhm.
Okay. How about your ears? Any pain, tenderness,
No pain.
drainage from
Nope.
the ears? How about your, you said no sensitivity to hearing?
Nope.
Any ringing in the ears?
Mm-mm.
Okay. How about your eyes? Pain in the eyes? Trouble with your vision? Loss of vision?
Nope.
How about the nose? Any nasal congestion or drainage?
Nope.
Sinus pressure, tenderness?
Mm-mm.
Nosebleeds?
Nope.
Okay. Lymph nodes? Any pain, tenderness, swelling in your neck?
Mm-mm.
Aching? Okay, we'll assess all of that in a little bit. How about chest pain?
Nope.
Palpitations?
Nope.
Swelling?
Nope.
Okay. And shortness of breath?
Nope.
Wheezing or
Mm-mm.
trouble breathing? Pain with breathing?
Mm-mm.
Or any recent cough?
No.
Okay. So moving on with the exam, my hands are clean. Remind me, what is your birth date again, Audrey?
April 3rd, 89.
Okay, so you're a 28-year-old Caucasian female. And what brings you in today?
Head pain.
And where are you located?
Well, where's the head pain?
No, where are you located?
Oh, I'm in the
Where are
doctor's
you?
office.
Okay, so she's alert and oriented ×3. Her movement of her body is normal. Her eyes are open, and she is talking to me and making sense. So I'm going to give the Glasgow Coma scale a 15, so no concerns neurologically there. Testing some of the cranial nerves, most pertinent to what I'm examining, I think, are 3, 4, 5, and 6. So we're going to go ahead and test the eyes with cranial nerves 3 and 4, looking for extra movement of the eye or sluggy pupils, sluggish pupils. If you could just look straight at me. Okay, pupils are equal and reactive to light. They're about 3 millimeters without the light and constrict to about 2 with the light equally. Also round, we'll get to more about the eyes later. Okay, they're moving bilaterally, no sluggish pupils. Now I'll test the 6 cardinal signs. If you could follow my finger, I'm checking for extra auricular movement or nystagmus. Okay, now checking those visual fields of confrontation. Tell me when you see my fingers. Got 'em? Okay. How about?
Got 'em.
Okay. And how about accommodation? If you could follow my stethoscope here. Okay, wonderful. So I'm not concerned about any eye movement, nystagmus, no trouble with her pupils, and that test cranial nerves 3, 4, 6. Moving on to cranial nerve 5, the trigeminal. I have a sharp object and a dull object. If you could close your eyes and tell me what you feel.
Sharp. Dull. Sharp. Sharp. Dull. Short. 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 Dull. Short.
Okay, so she does not have any concerns with her trigeminal nerve or cranial nerve 5. And a couple other tests. Could you tell me if you feel me equally with those eyes closed?
That's equal.
Okay, and could you puff the cheeks, smile, lift your eyebrows? Okay, so passed all the cranial nerve tests, and a couple of other things I wanted to do related to neurological examination, the Brodzinski and the Koenig test. If you could carefully lay back for me. Okay, Brodzinski test. I'm going to lift your neck. You tell me if there's any pain.
Nope. No pain.
No pain and no additional movement of those legs. So negative Brodzinski test. Now the Koenig test. I'm going to lift your leg. Tell me if there's any pain.
No pain.
No pain. Okay, so I'm not concerned about any meningitis. Those are both negative. Let's test those eyes again. Moving on to head, ears, eyes, nose, throat. As we said, pupils were equal and reactive to light. They are round and placed evenly on her head. And let's look for the red light reflex. There it is. And there it is. Red light reflex present bilaterally, and we already tested for accommodation. So eyes are appropriate upon examination. We discussed pupils were 3 millimeters in size, 2 millimeters to light. I'm going to check the conjunctiva are pink and moist, sclera, white, they're not yellow, no signs of jaundice bilaterally. And I believe that completes the eyes. So we'll examine the ears. Any pain or tenderness?
No.
Okay. So no auricular pain or tenderness. Now I'll take a look into the inner outer canal and the TM. So let's see here. Any pain or tenderness when I pull up on that?
No.
Okay. I'm not seeing any erythema or swelling, drainage, no wax or foreign objects. You said no pain or tenderness?
No pain.
Okay. Pulling up because she's an adult. Checking the same in this ear. No wax, foreign body, swelling, redness. It all looks normal. Any tragus pain? Okay. All right. Oh, okay. Sorry, I don't want to stand right in front of the camera. Let's move on to your nose and some other things. So let's lean your head back. Just going to look up your nose. Okay. Turbinates are pink, moist, not white and boggy. So as she denied seasonal allergies, that is appropriate. No drainage noted. Can you occlude one nostril sniff, occlude the other nostril sniff? Okay, so nares are patent, and so normal nose assessment. Moist and pink mucosa as well. Open that mouth. Okay. Hard and soft palate intact with no lesions. The buccal mucosa are moist, also lacking lesions. Stick out that tongue. Okay, I'm not seeing any problems there. Stick your tongue out.
Oh.
I mean, and out.
Oh.
Uvulas, midline, the fossa are pink, no lesions. She has had those tonsils removed. Not seeing any dental caries. Move your tongue side to side for me. Any pain, tenderness?
No.
Toothache? You said you recently were at the dentist.
Yeah.
Okay, great. So we did ears, nose, eyes. Let's move on to the throat and neck. We've touched on a lot of that. Uvula, tonsils, hard, soft palate. That just leaves the trachea, I believe, which is midline. Now let's check some of those lymph nodes. So the preauricular, the post-auricular, the occipital, submandibular, submental. Okay, any pain or swelling?
Mm-mm.
Okay. Super cervical, posterior cervical, and deep cervical. or tenderness there?
No.
Okay. So no lymphadenopathy upon examination of her lymphs. Moving on to her heart, I'm going to listen. Usually she would have her clothes off for this examination to get a proper listen, but for her privacy, we'll have her leave those on. I'm going to listen with both sides of the stethoscope to the aortic, pulmonic, Erb's point, tricuspid, mitral. If you could lift up this breast for me. Listen to the apical or PMI for 1 full minute. Okay, it's not shifted or deviated at all. And again with the bell. And lift that breast for me again. Okay. Have you had any, you said no chest pain, no swelling?
No.
Let's go ahead and check that out further. Pulses. Radial pulses are equal, about 2+, not bounding or weak. Capillary refill is also about 2. Pedal pulses present, equal. I didn't note any adventitious extra beats, so I heard an S1 and S2, no murmurs or gallops, so no concerns with the heart. So I'm moving on to the lungs. I'm going to take a listen. If you could take some deep breaths. This also would usually be under her clothes with her clothes off, but for her privacy, we'll leave those on. Listening under that raw line. Okay, any pain, discomfort? I didn't hear any adventitious sounds, no wheezing, rales, nothing to be concerned about there. I did count her respiration, so lungs were clear and equal to auscultation. I listened to all lobes. Those respirations were equal, and I didn't notice that you were having any labored breathing. You haven't complained of any trouble breathing. So vital signs, her blood pressure taken by my nurse was 120/60. Respirations I counted for a full minute were 16. Her heart rate when I had my nurse check and also when I was listening was about 68. Temperature 36.8 degrees Celsius, so no recent fever, no present fever. Oxygen saturation was about 99%. Last menstrual period you said was on or around September 2nd, and you're on the pill, so no concerns of pregnancy. And you rate the pain a 3 out of 10 today?
Yes.
Okay. So my 3 differential diagnoses were tension headache, cluster headache, viral and bacterial meningitis. So I'm ruling out cluster headaches because there's no associated eye or ear problems. She denied ear pain. She does not describe them to be cyclic. They're not like coming in attacks or waves throughout the day. They're just periodic. They are not that intense. She's not having any suicidal thoughts to go along with them because they're so intense. They're also more common in men and also associated with seasonal or altitude changes, all of which she denied upon assessment. I am ruling out viral and bacterial meningitis because there's no history of fever, no current fever. She denies a stiff neck. I didn't note, and she didn't complain of any nuchal rigidity. I also performed the Brodzinski and the Koenig tests, which were both negative, which would point to meningitis, inflammation of the meninges, so no concerns there. The headache is not severe or intense in nature. She denies photophobia, denies phonophobia, denies nausea, vomiting, and the pupils were equal and reactive to light and not sluggish. So not meningitis, probably not cluster headaches. My assumption would be a tension headache because of her use of caffeine, her recent stress. The location of them was mostly temporal. The character also went along with that, which was dull, comes and goes, and also the newer onset and somewhat predictable mornings when she goes without caffeine. So I would discuss that further with her in the next class. Any questions for me today?
No.
Okay, thanks so much for being my patient, Audrey.
Of